If you want to avoid possibly missing out on $45,000 a year and maybe more, you may want to continue watching the rest of this video or maybe listening to it. So I'm going to be talking about Modifier 25 and E&M 2021 today. For those of you who don't know me, my name is John Lin. I'm a urologist here in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group. Okay, I was seeing patients today, as usual, this morning, the typical 47, 50 patient day. And one of the patients was a cystoscopy. As a matter of fact, I have 7 cystoscopy with transrectal ultrasound scheduled for today. And I saw the patient, did the procedure, and then sat the patient down to discuss the findings regarding cystoscopy, transrectal ultrasound treatment options. And it happens to be a BPH patient requiring an additional workup. So the problem, for those of you who are E&M 2021 geeks, the problem is a chronic issue with progression requiring additional workup, not at goal. So that is easily a level 4 problem. I then recommended a procedure, or you could recommend an alpha blocker or some sort of an overactive bladder medication, anticholinergic, beta-3 agonist, doesn't matter. Your recommendation is a level 4 risk. Diagnostic endoscopy, for instance, is a level 4 risk. Prescription drug management is a level 4 risk. So now you have a level 4 problem with a level 4 risk, 99214. Of course, this was being done after you performed a cystoscopy. In order for you to build that 99214, you have to use a modifier 25. And I understand that some of you in your practices, the owners or the head honchos or the gurus up top do not want you to build modifier 25. For whatever reason, it does not make sense to me. Let me give you the implications of not billing in modifier 25. In 2021, it seems a lot easier to reach a 99214 after a cystoscopy, after an in-office procedure, meaning that modifier 25 event is going to occur. It's going to occur no matter what, but in order for you to maximize the return on your modifier 25, it seems a lot easier. I'm finding a lot more 99214s relative to pre-2021. So 99214s, how much does that pay? Well, for Medicare, it's about $131 and change for 99214. I'm doing 7 cystoscopies today, 7 cystoscopy transrectal ultrasound, very conservative number. It's nothing spectacular. I'm sure you all have done more or are doing more per day, and some of you less. Let's just take a very conservative estimate. I'd just say 2 of these encounters today are a modifier 25 event and yield a 99214. I'm in the office about 3.5 days a week, so I'm going to multiply that by 3.5. Say that I work 48 weeks out of the year, out of the 52 weeks. So I'm going to multiply that by 48 weeks. Hang on a second. 131.2 times 3.5 days times 48 times, 2. So I forgot to multiply by 2. So $131.20, 2 of those, assuming 2 of those a day, and then I work 3.5 days a week times 48 weeks. That is $44,000.83. That's just assuming 2 of these 99214 events, modifier 25 events, that if you're not billing for it, you'd be losing out $44,000 in change annually. Now, if you did 4 of these procedures, $88,000. If you did 5, you can just add it up yourself, right? So I'm doing 7 today, and I will tell you, more often than not, I'm having some sort of counseling with the patient after I perform a cystoscopy, because you all need to understand what is included in cystoscopy and what is not included. What is not included is a modifier 25 event, possibly. So as long as there's medical necessity, as long as there's distinct and separate documentation, discussion relative to the procedure that you did in the office, then you should definitely and rightfully bill for that Modifier 25 event. It could be a $44,000 difference annually if you just did 2 a day, and in a 3.5 day work week times 48 weeks, that's about $44,000. So don't make the $44,000 mistake by not billing for Modifier 25 events when appropriate. Learn from your coders and billers, learn from your reading and taking courses. Understand when is it legitimate for you to bill in Modifier 25 and when it is not. Learn about the documentation requirements and learn what is distinct and separately identifiable. All right? Questions, comments, as usual, leave them below. I love to interact with everyone. Best of luck in learning the nuances of 2021. Many of you are beginning to realize that it is not always black and white, and some of it is subject to interpretation, and most of it depends on your documentation in your chart in shaping the level of your E&M visit. All right, take care. Bye-bye.